Vaccination rates, specifically in children, have dropped nationally over the last year, including here in Mississippi. 3 News Side's Holly Emery joins us now to explain why this is happening. Holly?
Well, Howard, July of 2023 marked a milestone here in Mississippi surrounding vaccines. That's when parents were able to request religious exemption for their children to not be vaccinated. Parents in Mississippi have been taking advantage of their right to choose for their child to vaccinate or to not.
We're coming into a time where we need to stop looking at vaccines for the answer for everything and start looking at, keeping our kids healthy to begin with, where they can handle these what used to be routine childhood diseases.
According to the State Department of Health, 155 children are currently unvaccinated with a medical exemption. Since applications for religious exemptions went live in July of 2023, 5,088 children have been granted an exemption, bringing a grand total of 5,243. Madison and Rankin counties sit at the top of the list for the most exemptions in the Jackson metro area.
It's typically middle to higher income families that have degrees or multiple degrees that are reading and are aware of what the vaccine inserts say, what the risk is for their child to get that disease, if they get the disease, what the implications are, and then, what is the safety profile of that vaccine.
Mississippi still has 97.5% of its children vaccinated, but that has dropped since religious exemptions were allowed. Dr. Jewel Mullen with Dell Medical School in Texas says it could pose a threat if the number continues to drop.
In 2023, there were 4 outbreaks of measles documented across the U.S. That number quadrupled. There were 16 in 2024. So we're entering 2025 having even more concern as we see those levels of protection go down.
That's why she says it's important for parents to speak with pediatricians about any concerns they might have over a vaccine.
Sometimes people don't want to hear vaccines are okay and just leave it at that. For the vaccine that the mom might be concerned about, that's where it's important to have an even deeper dive conversation.
Dr. Mullen adds that you should do your research about what your child is being vaccinated with and to speak with a medical provider to clear any misinformation surrounding a specific vaccine. Holly Emery, 3 on your side.